Ladies and gentlemen,
about 20 to 25% of children live with behavioral disorders, that is inappropriate display of character following a few distractions in lives. This may be over activity, that is, they cannot settle, excessive crying, sadness, excessive laughter, and so many other inappropriate display of behaviors. And sometimes they may show defiance. But a question is, what really causes this? Now, last week we discussed behavioral disorders in children, and we looked at examples of several of them. That is conduct disorders, opposition defiant disorders, attention deficit and hyperactive disorders, among others, not forgetting depression amongst children. We looked at the different causes of the different disorders, but we felt like we, just looked at the tip of the iceberg, but we felt we needed more time to look at one of the commonest causes or one of the commonest disorders in children, and that is attention deficit and hyperactive disorder amongst children. It is one of the commonest. It starts way back from early childhood, and sometimes, if not well catered for, can progress to adulthood. It can affect their day-to-day livelihoods, that is the psychosocial interactions, their family, interactions, interaction with friends, school performance, and amongst other, as well as productivity in the adult lives. Welcome to the Pediatric Voice. I'm your host, Dr. Helen Namsoke, and this is the Pediatric Voice on Bethany TV for life. But before we delve into the discussion, let's first have the guest profile. You're welcome to the Pediatric Voice. Thank you for coming once again. And the viewers out there would love to hear from you.
I'm humbled to be here again. Thank you that an opportunity has still been provided to share about the challenges our children are having. I remain Jolie Magulu. Thank you.
Welcome. That is Jolie Magulu, mentor and an adolescent specialist in terms of psychological issues, and he is very interested in character development, as you have seen. But before we delve into the discussion of hyperactive and attention deficit and hyperactive disorders in children, let's first see a documentary on behavioral disorders in children.
Some children have difficult and challenging emotional and behavior characteristics that are outside the norm of their age. These may range from minor disturbances that are as a result of temporary stresses in their life to extreme disturbances that represent more enduring disorders. These range from tantrums, anxiety disorders, depression, conduct disorders, opposition defiant disorder, attention deficit hyperactive disorders, and autism spectrum disorder. The prevalence of behavior disorders ranges from 8.5% to 18%, with attention deficit hyperactive disorders cited as the most common disorder. Behavior disorders are more common among boys, orphaned children, and those living in war-torn areas at a prevalence of about 24.3%. These disorders have negative impacts on individuals, family, and society, and are often associated with poor academic, occupational, and psychosocial functioning. It is very important for parents and healthcare providers to familiarize with the presentation on behavior disorders for early detection and management to prevent adverse mental health status and improve the quality of life of children.
Yes, Jolie, you've seen the documentary. What is your comment?
In Uganda, currently, ADHD or attention hyperactivity disorder is about 11%. That has been consistent in most studies published. That means 1 in every 10 children we are seeing may have this problem. It means it is something that is available because
it is very common, and it is here with us.
Yes, it is.
Okay, thank you very, very much. Now, before we look at how common it is, what is this problem? What do you mean by attention deficit and hyperactive disorder in children?
We can just look at the word itself, although it sounds too medical, but as it is, attention deficit, it's just meaning that the child has challenges in keeping the concentration or being attentive to something they are supposed to do, appropriate to age. But also,
I thought children are supposed are easily distractible.
Yes, they are. Indeed, they are easily distractible, but they are also supposed to maintain a certain level of attention appropriate for age. It is normal for a child not to be attentive below the age of 5, 4, 3, that's okay because they're exploring a lot. But at around 6, we expect this attention to slightly grow and they can start to do some tasks and complete them. And hyperactive, it means their body is on the go. They are acting. They are kind of fast. They don't settle up and down. And then this is the common sign that brings the mothers and fathers to the clinic, being hyperactive. But sometimes the attention part of it is teachers who may complain, your child is not performing well, your child is not giving attention. But when they are not settling in class, the teacher will come, they're not settling at home, the mother will come, and also the father or other maids or helpers will come. So it's just attention deficit and then hyperactivity disorder.
So there are two things in it.
Yeah.
There is an attention aspect and then the hyperactivity, the non-sitting bit of it.
Yes.
The overdoing. Some of us are good at that.
It's okay. As long as
when we are doing something, we want to,
yes,
put in all our... Do we have a disorder? Let me hope
not
so.
really. You can handle here and there. It is natural. But yeah, we may have some traits of the disorder, and yet this is not severe enough for someone to call it a disorder. But there are some traits. Indeed, actually, being hyperactive to a certain level is more of an advantage. But if it is worse to an extent that everyone is observing it and you cannot actually settle, then that means now we need to help you.
So you're saying it is worse. Does it have levels? And to say maybe this is mild or maybe this is just an attention issue, this is a hyperactivity issue. Is it classified anyway? Yes,
there are levels. Other classifications consider attention part separate, hyperactivity part separate, but also impulsive part. You find that someone does not wait their turn. Before you finish the question, they are putting up the answer. They are raising up the hand and even saying the answer. But if whether they are on track or not, but they just can't wait their turn. That's another part. But at least we can say maybe mild, moderate, severe, and it helps us to judge whether to give this person drugs or not. Because yes, they are the drugs, but when someone is having the mild part of the symptoms, indeed you may not have to bring in drugs, but may just train the parent to handle the child, and indeed it works. Yes, there are levels we can try to give.
Yes, you are saying something very interesting. It can be classified. I don't know, I want you to delve deeper in the classification, the attention bit, the
hyperactive and then the impulsive. Now, the attention bit versus the age, there are things we expect you to do where you're sustaining that attention for that time. So we not expect a 6-year-old to do a task of 1 hour. No.
Okay.
No, that one, it would be unfair. But at least we expect a 6-year-old to complete a task.
Is there homework for like 15 minutes?
Yeah, 15, 20, 10, when they can actually do it and complete. Something like washing plates. It may take about 10 minutes, 15, and then when they are still sustaining, or when they are writing something, but when it comes to reading, you may reduce it to 10 because they may get tired if it's boring. But as someone grows, we expect this time of being attentive to increase. So like me now, if I'm not concentrating more than or close to an hour, then there may be a problem with my attention span. And even adults have actually ADHD. So it can progress through childhood too.
to adulthood.
If not treated. And now this hyperactive part of it, you see that someone, for example, we are seated now, but my friend that a child is inside squatting in the chair. It's like they feel as if their muscles are always on the go. And then after squatting, then they jump, then they greet, they say hi, then they move, they pull a wire, they go here, they pull a phone, they go there. And then they're everywhere. They are breaking things. And now that's the part where everyone can't wait. They're like, I think this child has a problem. But also, when we go to the impulsive part, imagine a child is in class, and then the teacher is speaking, and somehow an idea comes, and then they just raise up the hand and then say it out before even the question is completed. On the other part, you may find that they are at home, you're seated as adults, and then you're speaking. It may not be about them necessarily, but they may just speak to respond. It's like they do not wait to be asked when to respond and not to. And this makes parents angry, and they actually beat them for that. But although they don't know, they are not health workers.
Does it have to do with the level of brilliance of the child? You know, some bright children love showing off. They don't wait to be asked, and they always want to bring out
respond because they know it.
Yeah, because they know it. Sometimes, you know?
The level of brilliance of the child may not necessarily mean that, because we think that actually some have ADHD, if we would abbreviate it, but then they also have intellectual disability. Actually, their level of intelligence is very low, below average. And yet they have ADHD. Yes, they're impulsive, they're inattentive, and then they are hyperactive, but instead now the level of intelligence. So when we got the level of intelligence, but some are lucky. Some actually, if well controlled, and you may find that they actually have a higher intelligence, and they are actually creative because their brain brings a lot of ideas in a small, short time. They are able to put very many things, and then they are able to brainstorm. And this makes them creative at their workplaces. And it's a unique ability. Not everyone may have that, but comes at a cost of whether you're able to control that and do it in the steps you're supposed to, or you just bring all the ideas, just speak about them and just read them everywhere and then leave them there, which may not be helpful to you. But yes, the level of brilliance may differ. Some may not be that intelligent, some may be extra intelligent and surprising.
Okay.
Yeah.
You are watching the Pediatric Voice, and we are hosting Mr. Jolly Magulu, a clinical psychologist at Butavika Hospital, and he's teaching us about attention deficit and hyperactive disorder. One of the commonest disorders, behavior disorders amongst children. As we have seen, most of them affect their intellectual ability, school performance, psychosocial interactions, and among that. Please feel free to call in your friends to watch in on Bethany TV Uganda, that is on GoTV, and free to air, that is channel 841 and 170 respectively, as well as to call in. Share the link to them on Bethany TV Uganda, that is on YouTube, X Spaces, and Facebook. You don't need to miss this interesting topic. So, Mr. Jolly,
yes.
What really causes this disorder?
The cause of ADHD, we cannot point out one cause, but we can speak about risk factors, maybe. What predisposes me to have a child with
and
ADHD.
The other one is more calm. You know, imagine a home where one child is calm and another is all over the place.
Yes. So that's why we cannot say that this is the cause and point it out, because they will say, yes, this is the firstborn, this is the secondborn, but the firstborn is hyperactive, the secondborn is opposite, actually more calm to a level that we are worried, why are they so quiet? So yes, there may be some genetical contributions to the development of this disorder, but not entirely that they are the cause, but they are
genetic. Remember, genetics, we said, is an issue with your blueprint. Like when you're constructing a house, there is that blueprint, the one they used to follow in the construction. So the same with a genetic, it determines your makeup, how you will come out. So your blueprint is your genetics, how you will come out, the way your nose will be, the way you will use your nose, and how it will behave in case of anything is predetermined in your genetics. In other words, your blueprint.
Yes. So yeah, genetics is just one smaller part of the many contributors to this problem. But there are also other things like the time when we are in the womb. There are many things a parent may experience. Emotionally, maybe some stress. This also affects the development of this child because ADHD is also neurodevelopmental disorder. So that means it is there is a problem right from the development of our nervous system when we are babies. So you find that whatever affects the mother in the first weeks of pregnancy may also contribute to the development of ADHD or any other mental disorder by the way. So you find that that can be drugs, that can be diseases. When we say diseases, they can be HIV, it can be syphilis, it can be rubella. If you say drugs, you can speak of drugs that can cross our the mother's placenta.
That is the medicines.
Those are the medicines at first. If we say now the diseases, then we can speak about, we've talked about the diseases. If we say now the drugs, maybe like cotton shouldn't be taken in the first weeks of pregnancy. But you find that mothers in villages are actually giving it. You never know what will come out when you disorganize the development of the nervous system in the first
of the child. So dear parents, you've heard it very well. Some diseases, if not well treated, can predispose your child to some of these conditions like ADHD and other behavior disorders, as well as some medications that shouldn't be taken in such a period may also cause behavior disorders in your children as they disorganize the nervous system of your child. So caution here, once you do not feel well during pregnancy, please do not just self-medicate. Do not just stay at home and take it for granted. Feel free to visit the health facility so that you get an appropriate diagnosis and proper treatment to avoid such circumstances. Thank you.
Yes, that is the role of the antenatal care. If we appreciate that there is value in antenatal care and you follow what they say, when you get sick, you run to them. When you don't feel well, you run to them. You may save many things because they can find a disease. They can also give you the right drug for even malaria, but that will not affect your baby. But I think that many just buy flu-fed, buy what, and then they just follow some of these drugs. I think that some of them are contraindicated. And there are leaflets there in the package of the drug.
We don't read.
But we don't read. And yet the manufacturer will say contraindicated in pregnancy. But then still you will take it. So yeah, so if you're pregnant, okay.
Or in early childhood.
Or in early childhood.
Yeah.
Please, you read. At least take some few minutes. Just look for that part of children below 12, below 6, below 3. There are some cautions. Again, in pregnant, because there are special populations, you disorganize their growing, and then you cause a bigger problem that may be expensive to solve or irreversible. But then there is also this period of giving birth. A lot of struggle. Mothers delay home. As the labor pains are coming, they are still in their houses, and then the contractions are there. Maybe there is a problem. They can't just deliver normally, but because there is no health worker to help, time is going. By the time they reach the right place, somehow it is too late. Damage has already been done. Baby is not getting oxygen. Baby is injured. So you find that there is a lot of injuries caused to the brain of this child, but we may not see them with our eyes like this. But yeah, the health workers will know, the gynecologist will know, the pediatrician will know that yeah, the damage is there, but yeah, it has happened anyway. You can't just correct it there and then. So it is important that if you know you're going to deliver around this time, stay in touch with the person who will help you to deliver. So in case of anything, if you can't go, you can give a call and then they can give you advice on what is step 2. Maybe get someone to bring you, or let me send someone home, and then we see what to do. But at least it should be a trained health worker, not anyone else. Otherwise, may cause delay, and that slight delay may cause
us issues.
All these problems, which are expensive problems to solve. But then as the baby is growing, we are supposed to give them the right medication for their age, but also there are very many other diseases that can affect. For example, there are some diseases that mothers have when they are pushing, and then they can cross the eyes, and then other body parts of the baby, maybe there was blood sharing, and then the baby will suddenly get this disease, but then this disease has capacity to affect their brain also. So you find that everything that can affect the brain or the nervous system as the baby is growing. If I'm to be specific, the nervous system, because I'm talking about it a lot, is just that system that helps to send communication to our body cells. So it's like the telecommunication company of the body.
Thank you very, very much,
yes.
Mr. Magulu. We are having an interesting discussion on attention deficit disorder, one of the commonest behavior disorders in children. Please, let's continue after the break.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health.
Bwe ndowooza ku Ssekukkulu siyinza kwerabira kuzaalibwa kwa Mukama waffe Yesu Kristo eyajja otufiirira. Na mu kyo ekyokubi kye siyinza kwerabira kyabanga kiseera kya kujaguza na famire zaffe mwe mwabanga otuguliranga engoye wamu n'okugabana ebijjulo ne bakadde baffe bwe twali tuludde okulaba. Kyasinganga okunsanyusa ke kaseera k'olweggula ak'okusamba omupiira okugeza ng'ogw'abawuulu n'abafumbo kosa n'okutukkiriza ne tugendako mu firimu. Ebiseera ebyo nga firimu kya ttendo nnyo. Erinnya eryange nze Kintu Jackson nga ndi chef wano ku Lavita Cafe Bethany Hospital. Njagala okwagaliza Ssekukkulu ennungi naye nga kiki kitegeeza ku nze ng'omufumbi kiseera kibeera kya kugabana n'abaagalwa baffe. Wishing you the best of the festive season, a very joyful and a season full of laughter. May you have a happy and a blessed 2024. Don't forget to watch Bethany TV. Thank you so much.
Bethany TV for health.
Welcome back from the break and thank you for watching Bethany TV for health. You are watching the Pediatric Voice and I'm your host, Dr. Helen Namsoke, and today we are discussing behavioral disorders in children, specifically attention deficit and hyperactive disorder in children as one of the commonest disorders in children. We've earlier discussed the risk factors and defined the condition as well, where it involves an attention deficit part where a child cannot easily settle and complete the task that is appropriate for age. And then there is a hyperactive part where a child cannot just settle in one place. And guess what? Who is intruding on the show? What? It is Bethany Santa. How are you, Bethany Santa?
Hello, I'm fine, thank you. How are you?
Welcome to the
Nice to
Paediatric
meet you.
Voice.
My name is Bethany Santa Omugabe. How are you?
Hey, I'm good.
Hello.
Hi,
How are you?
I'm good.
My name is Bethany Santa Omugabe, and you?
I am Jolly Magulu, the receiver.
The receiver.
Yes.
So you really want to win yourself something, or you want me to give you something?
I just want to be given.
Yes, it doesn't come free. Ladies and gentlemen,
Okay.
ladies and gentlemen, good evening. I greet you all. How are you doing this evening? My name is Bethany Santa Omugabe. Now, wherever you see Bethany Santa on your screen, just pick up your phone and dial the number right on your screen, and you get to win yourself some goodies. I think we have a caller online.
Bethany TV, Uganda.
Hey, Bethan Santa. I'm calling to talk to Bethan Santa.
Hello.
Yes.
I'm your Christmas date.
Yes.
Hello, Bethan Santa.
Hello.
I'm your Christmas date.
Wow, amazing, amazing,
Yes.
amazing. Yeah. So what's your name and where you calling from?
I'm calling from Nabingo.
Okay, what's your name?
My name is Olivia from Nabingo.
Okay.
Olivia from Nabingo.
All right, Olivia, I'm going to ask you a simple question. Well,
Olivia, are you there?
I'm there, please.
well, what's the name of
Yes, please.
What's the name of the evening workout segment during the Sunset launch? And who is the presenter? There's that evening
That's one I've
workout.
forgotten.
There's that evening workout with that lady. Hello,
I know
hello,
the
we got
nutrition
there.
coach.
No, it's just, oh, sorry about that. Sorry about
Paediatric
that.
Voice.
Sorry about that. Sorry about that. So should I ask you another question?
Yes.
Okay, now we recently introduced a brand new medical series, a medical drama, which is always there from Thursdays to Fridays. So what's the name of that medical drama, that medical series called?
I'm sorry, I've forgotten.
Oh, sorry about that. Sorry about that. Sorry about that. I think you will try tomorrow or any other days.
Okay, I shall try another day.
Exactly. But thank you for watching Bethany TV. Do we have someone online? Yes, please, you can talk to us. Call us right about now. No, the most important thing is for our people to know. Hello.
Hello, Bethany TV, Uganda.
Yes, please.
Hello, Bethany Santa.
Hello.
I'm your Christmas day.
Wow, amazing, amazing. What's your name and where are you calling from?
My name is Osindi and I'm calling from Masanafu.
All right.
Yes.
Okay, just like I said before, usually on Thursdays and Fridays, we introduced a brand new medical series, a medical drama. So what's the name of that medical drama called?
Chicago PD.
Sorry?
Yes, you're on.
Can I get another question, please?
what's the name of the medical drama which is always there every single weekdays from Thursdays to Fridays in the evening, you know, exact at around 9 p.m. So as sorry?
Can I get another question, please?
All right. You know, every day, every weekdays, right after Bethany Sports at exactly 1 p.m. We have a show which always runs where you see your songs playing. So what's the name of that show called?
Pardon?
What is the name of the show which is always there every single weekdays at around 1 p.m.?
The playlist.
Wow, amazing. Congratulations. You've won yourself Christmas hampers courtesy of Bethany Santo Omugabi.
Thank you so much.
All right. We shall be calling you and letting you know when to pick your goodies.
Okay.
Yes. Thank you for watching Bethany TV. Thank you so much for watching Bethany TV.
You're welcome to the Santa.
Amen.
Thank you very, very much for winning yourself a hamper on Bethany TV with Bethany TV Santa Omugabi.
Yes.
And feel free come in on Friday by midday to pick your hamper at Bethany TV stations in Bugolowi on Luthuri Avenue here on Cemeteries Plaza. That is it we heard from Bethany Santa Omugabi.
I think we should give one lucky caller. You know, I'm in the mood of giving gifts.
No,
and
please, we know you're in the mood of giving,
yes,
but next
every
time
you see me,
feel free to come in every time on a Pediatric Voice.
Ladies and gentlemen, keep watching Bethany TV for the best shows, for the best program for your children, for each and every one. And get to know the name of the presenters, get to know the name of the shows and the time. That is exactly the question we always ask you. Stay tuned for more amazing program. From me, Bethany Santo Omugabi, I'll be coming back tomorrow to give you more goodies. Stay tuned and don't touch your dial. Don't touch your dial.
Thank you very much, Bethany Santa Omugabi.
Pleasure.
It's a pleasure. And thank you for coming through to the Pediatric Voice. Thank you.
It's home, and I think I'll be coming each and every time when you invite me.
Thank you.
Pleasure.
Thank you. That is it you heard from Bethany Santa Omugabi, and thank you. Please keep watching Bethany TV for life as you may win yourself a Christmas hamper from the Bethany Santa Omugabi. Now back to Mr. Jolly Magulu, and
yes.
We are discussing behavioral disorders in children, specifically attention deficit and hyperactive disorder among our children as one of the commonest disorders in children, and we are to look at the signs and symptoms. So how would the parents out there get to identify that things are not okay with my child? Maybe they have a problem.
Now, as I've said, it is important to always acknowledge the age. You may find that parents may start to look at 1-year-olds as having the problem. We say,
because they don't sit actually.
Yeah.
You tell them take tea, they are running to ABCDE.
Yes. It's normal for them. We said, think about this at the age of around 6 and above. So below that,
so
don't
it is
rush.
wrong to diagnose children of ADHD below 6 years?
Yes. It is not right.
But some of them are really too much, eh?
The assumption is below 5, there is still room for a change in development, and you never know, something can just become fine. So we still say it is a rush, you never know this is going to go away. But now when it clocks to 6 and they are not reducing, they are just worsening, then we say, you know what, I think we have no choice. We have to write down this as a disorder, and then this person receives appropriate treatment. But as a parent out there, you just have to look for a few things. One of it is you send your child to get something. Before they make a few steps away from you, then they're asking again.
They've forgotten.
What did you say? What did you say? What should I bring? You tell them, imagine telling a 6-year-old, pick that cup and then the sugar on the table and take to your dad. And then they reach the cup and they're like, Mommy, what should I use the cup for? Should I bring it to you? It's just a few seconds away. And then they're asking again. That's one point to note. But also the other good thing is that 6-year-olds in the current setting of Uganda, they are expected to be in a school setting somehow. If everything is okay with their development somehow. So you find that the teacher may have some complaints on the child. One of it is they're not being attentive in class. And one of the indicators of that is consistent poor performance. You must be a very good teacher. Actually must be a teacher and almost at the same time a health worker. They are special teachers, by the way.
Yes, they are.
Who can actually sustain their attention. They are trained to do that. But for the usual teachers that have been able to train us, you find that they may not have enough skills to focus on this one child of the 50 in a class.
Sometimes these days a class has 100.
100. So it is almost impossible for them. All what will show commonly is consistent poor performance. I'm not saying performance is majorly for ADHD, but I'm saying it may be an indicator of inattentiveness, which is not something that they are doing out of stubbornness, but something they are doing because they have a problem and they may need help. One of the things also to note is their energy levels. They may seem to have too much energy compared to
their age mates.
To their age mates. They can do many things in a short time and they would want to do all of them. They carry something to play with, for example, a doll, and then as they are moving with the doll, they pick the ball, they go as if they are going to play, they drop it, and then they have gone to the jumping. So you find that their body is doing all these things because their brain is working quite active compared to the average age mates. The other thing is that they don't wait their turns. Children, they have their own social system with rules. If we are playing, for example, we are jumping or we are kicking the ball, when I kick 3 times, you kick 3 times, then you kick 3 times. For them, you're kicking, we said 3, you're on the first one,
So
he is already in kicking.
So they don't wait for their turn.
They don't wait, and the others are always complaining, but that one is always that one. It's not because they are defiant, but because their brain can't wait.
Okay.
Yes, so it is not because they are bad in interacting, no. And then the other thing to also note is they seem to almost know everyone. For example, so-and-so, you know? If we had a child with the ADHD here, and then they get in, you find that they are making us all excited and focusing on them because they are moving up and down, saying hi, wanting you to carry her, and then, but we are total strangers. Otherwise, they would come and then first study, they're like, who are these people? What are they doing? At the age of 6, 7, we expect you to do that. But when they are touching everyone, saying hi, hello, moving up and down, moving the other side, sitting.
My mom is so-and-so, and then my daddy, you know.
Telling everything, if they can speak. Those are just a few things, but also there's something to note. In writing, you find that you have to always put attention. For example, like in drawing or writing, you find that they can't complete the sentence. Neither can they complete the drawing. Because as they are doing it, somehow the brain, boom, brings in this other new idea of something else to do, and then they stop on the way. So you find that they have a very beautiful idea, but they can't just complete it always. So there are a few things you can just test them with at home. And before even you test them, you will see it, that there's a problem. They also tend to break things at home. Not intentionally, but because they are handling many things at a time, and then they are doing it impulsively. So you find that they are carrying a cup, and then somehow the brain wants to carry the flask, and they may just somehow release the
cup. Drop a cup and pick the flask, and then before you know it, they're picking the plates.
So in that way, parents beat them because they are breaking things all through the day. When you send them to wash cups and then or glasses, then trust me, you're going to buy a new set. Because the speed at which they are working, trust me, they will not even complete the task anyway, but they will break something at least. It's not because they want to break, but it's because the brain is doing many things at the ground. When you're doing some of those activities like washing breakables, you need to be calm, which they cannot be. You need to concentrate, which they want. So you find that in not doing those two major things, they'll just go on breaking many things. So that's the other thing to also think about. But also we have to know that their energies increase after eating a meal that is having glucose. For example, when you give them a soda, it's like if you wheeled a vehicle.
What you've given.
You'll have to chase them the whole day because you've provided ready glucose. So sometimes that's why we always say it's better to give foods that are not having too much glucose. So
having seen the signs and symptoms, where would a parent go for diagnosis of their child?
There are many different professions who can help. We have psychiatrists, pediatricians can also help. We have child and adolescent mental health specialists. This can be child psychiatrists. This can be psychiatric clinic officers. You find that some nurses could also help if they're working in mental health settings. So all you have to do is, if you do not know any mental health personnel around you, you don't know anyone practicing mental health services around you, just go to a children's clinic around you. They will help you.
Or a hospital.
Or a hospital. They will help you, even if they will not. They will say that we may not treat here, yes, but they will know what it is, and they will send you to the right place without spending a lot of time and money elsewhere. So the health facility near you, we believe there is someone helping children. That person can actually help that child to diagnose or even treat or even refer you if there is need of a referral.
Okay, thank you very much about that. Is ADHD treatable? And if so, what can I do as a parent about it?
We can start, yes, it is treatable. But we can start with what can the health worker do. The health worker on their side, they can prescribe drugs. But these drugs are given according to severity. If it is too severe that the parent is distressed, the parent is tired of chasing the child the whole day, then you find that they'll have to introduce this drug to improve the attention and to calm down the child. But that's just the health worker part of it. But 90% of the work is with the parent, because the parent, or the one who is providing the help in terms of parenting to the child, is the main doctor, I would say. For us, we just train this one to play our role.
So how does a parent or guardian taking care of a child that is living with ADHD, how do they deal with this child? What can they do in their means to make sure that this child improves?
We can first reduce unavailable glucose. Sugars like cakes, sodas, juice with too much glucose.
Artificial drinks, yogurt?
Yeah, yogurt if it also has some glucose. Yeah, but usually yogurt has glucose.
So the flavors.
They could do.
They can do the non-flavored one, eh?
Yeah, but will they take those things without sugar, children? I don't know, but if they accept, yes. But also with foods like cakes and what, you may reduce. I'm not saying don't give totally, but please try to reduce as much as you can, such that they do not have that free glucose to run around, otherwise it will be you to chase. That's just one.
So in others, we do not add sugar to their tea or drink.
If they can take without, but something very hard with the children if you've trained them to take. So you can go slow, you reduce slowly, don't just suddenly stop. You reduce so that they are not recognizing that the amount is reducing until they get used to one without or one with less. Then that's just one. The other thing is avoid beating. We talked about it last time. Beating does not help, because with these disorders, there is a scientific explanation for them. So that means just mere beating will not help. Instead, it may worsen or it may bring in new problems.
New tactics.
As they are adapting to the beating. So the best thing is you can instead reward. If you tell them, sit down,
do your homework.
Do your homework, complete, or eat your food and complete, then you get out to play. And they happen to struggle and then they want to get up, you look at them, they sit down, they eat. The body is saying to them, get out, go and play. Then they look at you, they eat, and then they complete the meal. You can clap for them and even hug them and tell them, go and play. And be consistent to such acts. As we said, consistency is key.
It's very important.
If you tell them when you complete, you go and play, and then they complete, you like wash plates.
That means you need to choose rewards that are affordable and easy to give.
Yes, because you will fall into the child's trap.
Our children these days love money. They want to hear money, bouncing, castle, swimming.
Some will even ask for a phone. And if you give a phone today, you give a phone tomorrow. So, I mean, give simple things. Things that involve you to move and take the child somewhere. You may not do that at night. What if they complete the task at night? Will you take them? For swimming. You won't. So, do simple things. Clap, carry them, hug them, sing for them, dance together. Those simple things at home. You may seem to be a child, but the best way to help a child as a parent is to leave your world and enter the world of the child. That's the playful one. Be a child to a certain level so that you can be able to survive together. The other thing is you can take away what they love if they are not fulfilling the agreement. We agree you're supposed to
So in others, you give positive and negative rewards.
That is it. Because I told you to sit down and then you wash plates, you complete them. They're just about 4
so
plates.
that you can watch cartoon after. But now you've not completed a plate, no cartoon today.
And indeed, don't. So you've taken out something they love. They will cry, they will like hate you. But tomorrow they will know that if I don't, I want to get this. So that's a simple thing. You're not beating, but the brain is learning that if I want this, I need to do this. But when in fulfilling what they need to do, they are actually improving. They are growing out of their disease. And this is something that you're doing without harming the child, without also hurting yourself, because as you beat the child as a mother, you also feel bad. You wouldn't love to do that. So those are just a few things. But some things you can do is to also try to help them associate with others and let others teach them their rules. You can tell other children to teach them their rules as children.
Rules of games they do, rules of interaction.
To learn to wait. Learn to wait. Please wait. Your mother told us we shouldn't allow you if it is not your turn. Then they will feel bad or what. But then they will wait patiently as they're almost jumping and then they enter. In the end, they will start to wait. So,
okay, having seen what the parent has to do, it looks like most of the work is on the side of a parent/guardian. So are there centers? Is there a way how does a parent learn all this that they have to do? Are there places they can go and be trained as parents on how to deal with their children?
Yes. Mental health professionals who are working with children, you find that, or even psychologists who are trained to help children, they can actually do what we call parental training. It can be a one-on-one training, it can be a group training, but there are also some non-government organizations or settings that may also provide the same service when they have these professionals. So they can gather these parents or they can call these parents and then they train this person in helping the child. So yes, there are such centers. You can even go online. There are online groups for parents of children with ADHD. You can join them and then they tell you what they are doing. You try to adapt and test it on yours. If it's working, continue with it. It is a try here and there, but you learn to be the best doctor because at a time T, you'll have to even advise the doctor, doctor, that one didn't work out, but this worked. So you find that you're becoming the expert in your child. It means you are at peace because this child can frustrate you. But when you're starting to learn to be the doctor of the child, you start to be at peace because you know what you're going to expect from them. You know what they're going to do anyway, so you're not worried, and you know how to tackle it and get the best out of them. So there are such places, but there's also one other place that is good to help the child, the school. This child, whether we want it or not, they should attain some level of education. And some of them are actually good. There are those I know who are actual medical officers. There are some I know who are very good nurses. There are some I know who are mental health practitioners. But how have they succeeded to train in a medical school that requires a specific level of attention to go through and pass? But they've been able to make it. They even have their certificate. They're actually practicing, and they're the best because they know what it is. They are on both sides. They may be on their treatment, or they may have grown out of it somehow. So I mean, they should be in school if they can study. So the teachers somehow should get to know this problem early. If you know your child has been diagnosed with ADHD, talk to the head of the school and also the teachers who are directly in interaction with the child, because they may be beating. You may be struggling at home, but the teacher at school is beating because they don't know. They think the child just stubborn, pinching others, pulling others' pencils, books, what, and then causing the whole class to laugh. Then they are beating them. But when you speak to the teacher and tell them, my child has this problem, this is what it is, this is what teachers can do. Online there is information for teachers. Yes.
Thank you very, very much, Mr. Magulu, and thank you for teaching the world about ADHD and behavior disorders in children at large. Now, that is it we had this week on the Pediatric Voice. We have had an extensive discussion on behavior disorders in children and attention deficit and hyperactive disorder at large. We have diagnosed it, and we have learned that actually most of the treatment or the care for the children that are living with ADHD is actually non-medical. Very few instances that they will require a tablet or a drug to take care of the condition. Most of the time they require the behavioral therapy or the behavioral grooming, and most of it is done way back at home by the parent that is involving the negative and the positive rewards to the children, depending on their fulfillment, level of fulfillment of the tasks given, as well as the teachers at school. In other words, the teachers, the parents need to take time to study these kids, these children, to see those that have a problem so that they can have an appropriate diagnosis on time, as well as take time to, teach and influence the behaviors of our children. Remember, a productive child will amount to a productive adolescent as well as a productive adult, as we aim for the middle income status in our country. That is it we had on a Pediatric Voice this week. I've been your host, Dr. Helen Namsoke. See you next time.